thing. Not always are we lucky, though, when it comes to certain conditions. So, did you know an inherited condition could be the cause of your early heart disease? So joining us to tell us more about this, I am joined by Katherine Wilemon. She's the founder and CEO of the Family Heart Foundation, and Dr. Seth Baum, preventive cardiologist. Thank you both so much for waking up with us.
Thanks for having us.
Good morning.
Good morning.
So Katherine, I understand that you actually had a heart attack at my age, 39, and you later learned that one of your risk factors was elevated Lp(a). Can you tell us a little bit more about what happened?
Absolutely. You know, it was super scary when I had the heart attack, but I knew instantly that something was wrong when I had crushing chest pain. And when I called 911 because I was young, I really had to advocate for them to take it seriously. But what I learned later was the reason I had a heart attack so early was because I had inherited two genetic risk factors for cardiovascular disease. One is FH, or familial hypercholesterolemia, that causes high LDL cholesterol from birth, but the one we're here to talk about today is elevated lipoprotein(a). And now, this is very common. About 1 in 5 people have inherited this condition, or 20% of the U.S. population. That's about 60 million Americans. And what we know from our own research is that in the last 10 years, less than 1% of people have been screened. So it's highly underdetected.
Geez, so doctor, who should be screened and when?
Well, so I'm a preventive cardiologist. I would say everybody should be screened. It's very important. It's highly prevalent. It's very risky. It increases the risk of heart attack and stroke. So Lp(a) is something we should all know about. And we can do something about it if we have elevated Lp(a). We can reduce other risk factors like LDL cholesterol. Everybody gets screened.
And when should we do this? And what can we do to reduce our risk of heart disease and stroke?
So we should check the Lp(a) tomorrow. Go to your doctor, or contact the Family Foundation, and they can help guide you to how you can get the test to reduce the risk of heart attack and stroke. Reducing risk factors is the key. LDL cholesterol is probably the one that's not reduced enough, believe it or not, in the United States. And for that reason, there's a genuine public health crisis with regard to LDL. But blood pressure, maintaining optimal weight, exercise, all these things are very, very important.
Well, thank you both. Again, tell everybody where we can go for more information.
People can go to familyheart.org. We have a lot of information about inherited risk of cardiovascular disease. And there are also live people to talk to you on a patient support line if you want to talk to a real person.
All right. Well, thank you both so much.
Thank you.